What is Suboxone and how does it work? Suboxone is a medicine that contains buprenorphine, which helps treat opioid addiction to drugs like Oxycontin, Percocet, and Vicodin, or street drugs like fentanyl and heroin. Suboxone reduces cravings, prevents the worst of dope sickness or withdrawals, and protects people from overdoses if they do use. Unlike methadone, you don't have to go to a clinic every day to take it. Your doctor sends a prescription to your pharmacy, and you can take it in the privacy of your own home. Best of all, Suboxone saves lives. People taking Suboxone are over 50% less likely to die from an overdose. That's a big deal. So, how does it work? Opioids like Oxycontin and fentanyl affect the pain receptors in the nervous system. They work by turning on the opioid pathways in the brain and body, which reduce pain and make people feel calm and peaceful. This is why they're so useful as pain medicines, but also why they're so addictive. Suboxone is different. It both turns on and turns off the opioid pathway at the same time. That's probably kind of confusing, so here's an example. Think of the opioid pathway like a speedometer in your car. For someone who has never taken opioids before or doesn't use them regularly, a small dose triggers the pathway, turning it on to provide pain relief. However, if someone uses opioids every day, the body starts to expect and want the drug, and their speedometer changes. The same dose won't work. They need higher and higher doses to get that same feeling. And even worse, if that person stops taking opioids or takes less, the body goes into withdrawal and becomes dope sick. Awful symptoms like shaking, sweating, vomiting, diarrhea. Withdrawals feel horrible. This often drives people to take more and more, sometimes leading to overdose. After a while, addiction is less about getting high and more about avoiding the horrible feeling of being dope sick, trapping people in an awful cycle between using and withdrawal. Suboxone stops the cycle by setting the speedometer on cruise control. It turns the pathway partway on, say about 30 or 35 miles an hour. This prevents the worst of withdrawal. As long as people keep taking it, they'll never dip below 30. That's the on effect. But Suboxone also blocks the effect of other opioids. It won't let the speed go above 35 miles an hour, protecting people from overdoses. Suboxone does not make people high. Instead, it reduces cravings, and if someone does use, it blocks the high, which helps people quit. This is the off effect. You may have heard some rumors about Suboxone. Let's talk about them. Rumor number 1. Does Suboxone make people feel worse? Well, it can if it's taken at the wrong time. Since it's setting the cruise control at 35, if someone just took opioids 3 hours ago and is at 65 when they start taking it, Suboxone will immediately bring them down to 35 because of that blocking effect, throwing them into withdrawal. This is like slamming on the emergency brake while driving down the highway, and it doesn't feel good. This is called precipitated withdrawal. To avoid this, wait to start Suboxone until you start feeling withdrawal symptoms like nausea, vomiting, and restlessness. Many people need to wait about 12 hours after using fentanyl or snorting pills, 16 hours after swallowing pain pills, and 72 hours after taking methadone, but the timing can be a little bit different for everyone. There are medications to help treat withdrawal symptoms while waiting to start Suboxone. Over time, the body gets used to 35 miles an hour and people start to feel normal again. But everyone's speedometer is a little different. Some people need their dose adjusted, setting them to 40 or 45 miles an hour instead. Some people need a little less. Rumor number 2, Suboxone isn't strong enough for people who use fentanyl. This is false. Suboxone has worked for many people who use fentanyl. There are a small number of people who find Suboxone doesn't fully manage their cravings and may need to try another medication like methadone, but Suboxone has worked for many people who use fentanyl. Rumor number 3, is taking Suboxone just trading one drug for another? Nope. Here's the difference. Let's compare fentanyl and Suboxone. Fentanyl has a high risk of overdose, and Suboxone blocks overdoses. Regular fentanyl use leads to daily cravings and withdrawals, while daily Suboxone use stops cravings and withdrawals. Fentanyl from the street is unregulated, illegal, and unsafe, while Suboxone is regulated, legal, and safe. With fentanyl, people need more and more over time. That's addiction. With Suboxone, once someone's on the right dose, it's steady and stable. That's dependence. Most importantly, fentanyl destroys lives and is the leading cause of overdose, while Suboxone saves lives. Suboxone can help you feel like yourself again. To find treatment, go to findtreatment.gov or talk to your doctor.